I'm Mike Roberts. I'm the Senior Clinical Lead for the National Chronic Obstructive Pulmonary Disease Programme. I'm pleased to say that I've been involved in the programme since the year 2000. When we conceived the audit originally, we wanted to move away from the previous audit programmes which had really just measured care in the acute hospital setting to one which was more representative of the whole patient pathway. So this current audit programme measures care in general practice, in primary care, and in the community through pulmonary rehabilitation programmes, as well as the acute care setting. So why should you participate in the audit? I like to think, and I'm sure I'm right, that most clinicians and managers, whether they're in hospital or pulmonary rehabilitation, or whether they're general practitioners, nurses or physiotherapists, come to work each day wanting to do the best for their patients. But the evidence from the national audits in 2008, 2014 have been that there is a huge variation in care. And that variation is between organisations, but it's also within organisations. The worrying thought is that as a patient, the quality of care you receive is dependent very much on happenstance and circumstance. Now, that's unacceptable for patients, and I think it's unacceptable to us as clinicians and managers who all want to give optimum care for our patients. So how do we go about addressing that deficiency? And I think the first and most important thing is to understand at a local level how good we are at doing certain things and where there are deficiencies in our care. And if we're collecting data, that helps us understand that, and then we can start to plan improvements based upon fact and not upon assumption or upon anecdote. So that, I think, is the really first important thing. At a national level, I think collecting data across a number of organisations helps us provide information that influences national policy, and I think that shouldn't be underestimated. Respiratory medicine, COPD, it needs to have a profile. In a sense, we are fighting for a limited resource. We want to make sure we get a good resource for our patients, and by presenting data at a national level, we can do that. The local reports, I think, are really important for hospitals, for pulmonary rehab programs, and for general practices, because what they do is define the standard of care that is provided by that organisation or institution against the gold standard, which are the national guidelines, but also benchmarked against the average across the country. And that tells you what is really genuinely achievable, because if other organisations can manage to provide that standard of care, then for sure that's what we should be aiming for. Sometimes the guidelines seem to have standards that are so high that nobody can reach them, but when we benchmark nationally, we know what is achievable.